In the spring of 2022, I was approached by Boston Children's Hospital uh, and Williams James College and Brigham and Women's regarding a grant through Mass Hire that would essentially engage and recruit individuals who are entry level in from our local communities of service for a mental health specialist training program. Mental health specialists do a variety of things on an inpatient psychiatric unit. They're also referred to as like behavioral health techs or mental health workers on inpatient psych units. They are the paraprofessionals who engaging with patients throughout the day to check in, make sure patients have what they need. They're also instrumental because they are consistently communicating back their observations, any like wins for the patient or concerns with our nursing and medical teams. The goal was to engage people who otherwise would not be typically considered for professional positions due to a lack of experience, and provide them with 10 weeks of college courses through Williams James and on-site preceptorship through the inpatient psych units, mentorship, training, coaching, and eventually hire them into permanent positions as mental health specialists for inpatient behavioral health units. And at the end of the 10 weeks, successful participants who graduate from the program do receive a certificate as a mental health specialist, which is one of the first in the Commonwealth. So far, Brockton Behavioral Health Center has had 6 participants go through our program. We've actually hired 4 of the participants. So 2 are full-time and 2 are per diem. One of the per diems decided on that status to go back to school to continue their education. While they're in the program, their courses through Williams James actually gives them 3 college credits. We're constantly thinking of ways to engage and increase awareness around this program because it's just a really good step for people who are interested in working in healthcare to take the first step under supervision and guidance and formal training to get their foot in the door. The way we notify people about this training opportunity is mostly through social media and also through word of mouth, through our community networks. Upon starting the program, the participants undergo a set number of hours of online schooling through Williams James College, and then work a set number of hours on the inpatient psych units. Each hospital provides the participants an area to do their schooling remotely on site. And so it can be up to part-time every week, and including the schooling and on-site training. We're actually pretty intentional about engaging individuals who are, number one, from our community or surrounding communities, and who identify as people of color. And we see that a lot. People who moved to the United States and were like doctors, nurses, teachers in their country of birth, and then move here and aren't able to either afford or haven't had the time because they're taking care of their families and trying to acclimate to new communities, to go back to school or get their board registration and license. So we are intentional about making sure that we're interviewing people who otherwise, just based on experience and data, would not have an opportunity to get their foot in the door, especially in a system like a large healthcare system.